there's a surface layer. I'll show you in a minute. I have a figure. But the cornea can be easily damaged, and as you said, it depends on the extent of the damage as to whether or not it can be repaired. There are things called corneal stem cells that are constantly repairing the epithelium, which are those upper layers, which is the upper layer of the cornea, and that's minor damage. You have everyday wear and tear when you're blinking and rubbing and scratching your eyes. And that damages things, but those corneal stem cells are constantly making a replacement layer for that upper layer. So even a minor injury to the epithelial layer, which is the surface of the cornea, may be repaired in a day or two. So here's the figure I was telling you about. If you notice, there are three layers. There's the epithelium. Epi means on top of. So this is kind of the outer skin layer. There's a stroma, which is that middle thick layer. And then there is an endothelium. Endo means in or inside, and that's the bottom layer. So if you damage the epithelium, chances are it can be repaired. If you damage down into the stroma, may or may not be able to, especially if scarring occurs, then it's going to damage some vision. And the endothelium has no stem cell regeneration properties or possibilities. So when the corneal stem cells are damaged, the epithelium cannot be repaired. And as we said, if the stroma layer is damaged, you can get scarring, that can be bad. And we already mentioned that endothelium layer doesn't have any regenerative capabilities. So that last part there, with more extensive damage, the eye is unable to repair the damaged cornea, and transplantation may be necessary. So if you got a cornea that's got really bad damage where it can't take care of itself, repair that damage with the stem cells, then you may need to actually have a transplant. It says chemical burns are usually the most damaging external injury to the cornea. So what was it that happened to Lucy? Nasty burn, yeah. Okay, question 3. What is a cornea transplant, and how successful is the procedure? Well, basically it's taking cornea from someone else, sticking it on there and sewing it in and seeing if it will work. Traditional cornea transplants are dependent on the availability of a donor, so you've got to have a donor. Question?
I just got a question regarding the picture that I saw on the internet. There's like this the eye, like cornea, like repaired cornea. It seems like there's like some I don't know. They don't stitch it, but there's like some stitches, kind of. There can be like 1 or 3. Like
yeah, they do stitch it.
Oh, do they?
Yeah, they stitch it to hold in, and then it will hopefully grow, kind of heal itself and grow around the edges, and then they take those. Either they take stitches out or they dissolve.
Oh, okay.
Okay. So if you have to have a donor, first of all, you find somebody nice who says, yeah, I can part with one of my corneas. You know how that works? What are the donors? Who are the donors? Dead people, basically, yeah. But how dead are they? Are they mostly dead?
Brand new dead.
Brand new dead. Yeah, they're fresh dead. They got to be, what did we say? I think it was less than 12 hours or 24 hours. I think it was less than 24. For it to be successful. So the cornea is then removed and delivered to the patient for surgery. The damaged cornea of the patient is removed, and the donor cornea is anchored into place with stitches. After a period of healing, the patient usually regains partial to full sight. So the success rate is actually pretty high. They say that generally about 90% initially are successful, but there are a lot of factors that may affect the successful transplant, and there's some potential problems. Some of those are that the body could reject this cornea from somebody else. Now that's kind of rare because there's no blood flowing between those things, so generally rejection isn't as high as, say, if it were like a heart or a liver transplant. The cornea has no direct blood system, I just said that. And the success rate of corneal transplants declines in patients exhibiting extensive scarring. So if you have really bad scarring, then the success rate lowers. And with those who have had prior rejection of corneal transplants. So what's Lucy's situation?
Photon.